Hi to all, myself Durga Devi, nursing tutor, E.S College of Nursing. So today we are going to discuss about the topic is diaphragmatic hernia. So diaphragmatic hernia of the pediatric. So definition is diaphragmatic hernia, also known as a congenital diaphragmatic hernia, shortly we called as a CDH in a babies, occurs when a defect or opening in the diaphragm allows the abdominal organs to move into the chest cavity. It has a two types, Bogdalic hernia and Morganic hernia. So it is a picture that shows the normal diaphragmatic development and the congenital diaphragmatic hernia. So in the what the effect of diaphragmatic hernia is having means the lung is affected in the one side may be compressed or the collapsed by the organ like a intestine and stomach in the thoracic cavity, and the stomach also become distended by entering the air which is swallowed or pushes the mediastinum to one side. So the clinical manifestations like dyspnea, tachypnea, cyanosis, increased chest size, shock, hypoxia. So in the dyspnea, the difficulty in breathing, increased breathing, cyanosis, a bluish coloration of the skin, increased chest size, shock may be happen, hypoxia will be happen. So these are the major clinical manifestation we can find it out in the diaphragmatic hernia. Like investigation, what are the major investigation for assessing the diaphragmatic hernia is the first thing is physical examinations. In the physical examination, we can easily find out that the chest size is increased and in the abdominal size also increased. So early diagnosis during the antenatal period in case of hydramnios or with the aminographic studies. It helpful to study the uterus, placenta and how the baby positions are there, and also the chest x-rays and abdominal x-rays can easily find out the diaphragmatic hernia. And then now pre-operative nursing care. So the suctioning of respiratory secretions to prevent the infection, increased head size in the baby positions with the raised at the 45-degree, and maintain the O2 level by O2 administration when the endotracheal tube is insertion, because the baby is having a difficulty in breathing. And then regularly monitoring of the blood oxygen level and the blood glucose level, acidosis corrected by the sodium bicarbonate. Give antibiotics after doing the culture or any sensitivity test. And the surgical management. The surgical management of diaphragmatic hernia involves the reducing herniated organs, repairing the diaphragmatic defect, and potentially using the patch or mesh for the longer defects with approaches including open surgery or minimally invasive techniques. So in the surgical approaches, open surgery, that the first one is a traditional approach. Subcostal incisions on the side of hernia allows access to the diaphragm and herniated organ. And another thing is a laparotomy. An upper midline laparotomy can be used to assess the abdominal cavity and reduce the herniated organs. And then the thoracotomy. So in this cases, the thoracotomy incisions into the chest wall may be necessary, especially for the chronic and the dramatic herniasis. And minimally invasive surgery, that is shortly called as a MIS, the laparoscopic repair. For the stable patient with a smaller defect, laparoscopic repair through a small incision can be made it off. And thoracoscopic repair. Thoracoscopic repair, usually a small incision is made in the chest wall, and also considered for the stable patients with a smaller defect. And another is the post-operative care. The post-operative care is after doing these surgical repairs, and the section is called as a post-operative period. So in the post-operative period, we regularly monitor the vital signs because it helps to monitor the patients, their vitals, and also maintaining the respiration level by administering the O2, maintaining aseptics and also the hygienic pattern, which helps to prevent the cross infections and developing any wound deformities, and maintain the nutritional level also. It helps to repair the wound quickly. So these are the books Von Sperry and Hockenberg and Emil von Mick. These are the books we can refer and getting the content. So this is all about the diaphragmatic hernia. What are the definitions, causes, and what are the clinical manifestations, and what are the surgical management we have done, and all those things we are discussed. Thank you.